Welcome back, everyone. Our next presenter is Diana Isaacs. She is coming to us from another galaxy almost, another time zone. So we thank her so much. Um, she has a lot of credentials behind her name, but I'm going to say Diana Isaacs, PharmD and Certified Diabetes Care and Education Specialist. She is currently the Remote Monitoring Program Coordinator at the Cleveland Clinic. She provides medical management and runs a robust CGM shared medical appointment program. The title of her presentation today is Continuous Glucose Monitoring Demonstration and Q&A. And Diana's going to keep this pretty interactive, so she's going to answer questions as they come in. So thank you, Diana, for joining us today.
Great. Thanks so much for having me, and thanks for everyone in attendance. So yeah, if you have questions as we're going along, please feel free to just put them in the chat, and I'm happy to answer them. There we go. There's the slides. All right. So with that, I wanted to start off just kind of by going through, well, how does CGM work, right? So it's measuring glucose from the interstitial fluid, which is different from a finger stick, which is actually measuring from the capillary. And it's continuous. So it's basically measuring every 1 to 5 minutes, depending on the device. And then it's recording it every 5 to 15 minutes. And so if you do the math, every 5 minutes is actually 288 readings per day. So it really is a lot of information. And there's a slight delay from finger stick data. We call that a lag time, although it's pretty minimal. And if you look here in this picture, you can see the sensor. The sensor is this tiny bendable, it's kind of like an eyelash, and that's just barely under the skin. And that sensor is communicating with something called a transmitter, which is right on top of it. And then that communicates to some type of display device or a reader, a receiver, or often it's someone's smartphone. And then depending on the device, the transmitter and sensor might be all together as one, or sometimes it's two separate parts. So with that, I always like to use this visual to really show, the difference between blood glucose monitoring and continuous glucose monitoring. And what this is showing, those 4 dots represent someone who's doing finger sticks. And this green area represents something called the target range. And we usually, for most people, we say the target range is 70 to 180. And this represents a 24-hour period. So if I just saw those finger sticks, or someone was just checking at those times, they would probably think that they're in range, they're meeting their blood sugar targets. But when the person wears CGM, and that's what you see from this line here, we find that there's actually undetected hyperglycemia or high sugars. And then there's also undetected hypoglycemia or low blood sugars that the person would not have known about if they were only doing finger sticks. Now, in addition to that, we also have real-time data. So this is that in the moment when someone can go ahead and see what their number is, either by scanning it or just by looking at the device. And also, in addition to the number, there's also an arrow. And that arrow is so valuable because it lets you know, is your blood sugar rising? Is it falling? Or is it relatively steady? And this is really important because let's say you're 110, right? And you're getting ready to drive a car, or you're getting ready to go to sleep. Well, if you know you're 110, you might say, okay, well, that's in the target range, so that's okay. But what if it's 110 with an arrow going straight down? That means in the next 30 minutes, you can be 60 to 90 points lower, which would not be safe, right? And so the advantage of CGM is it lets you know, are you rising? Are you falling? Is it safe to do the next activity? Plus, most of our devices now have alerts to even let you know proactively if you're high or low. And some even have predictive alerts that are predicting when you're going to go high or low. So there's really 2 different categories of CGM, and that includes what we call real-time CGM and then intermittently scanned CGM. And so real-time CGM is basically constant data without having to do anything to interact with it. You would just have to look at your phone, your display device, that's it. And depending on the device, they're FDA approved for ages 2 and over. And many have predictive alerts and, or actually all have some level of predictive alerts. And then there's also compatibility with insulin pumps, with connected insulin pens, as well as smartphones. And then with the intermittently scanned, that is where you do need to scan to see your glucose level. And these devices must be scanned at least every 8 hours to be able to record all the data. So if it goes longer than 8 hours, some of that data just wouldn't be recorded when we go to download it. FDA approved for ages 4 and over, depending on the device, and some do have high and low alerts now. And then there is compatibility now with smartphones and then connected pen caps. There is not compatibility with insulin pumps yet at this time for that. So we basically have these different options available. So for Libre, we have the 14-day, and now we have the Libre II. For Medtronic, we have the Guardian Connect or Guardian 3. And then we have the Dexcom G6 and we have Eversense. And so I'm going to go through each of these. I'm not demonstrating here in my hands, but I do have a picture to show you what these devices look like and everything. And I'm seeing a question come through the chat or the Q&A about, does Medicare cover these devices? And actually Medicare does, but there is certain criteria that must be met. So they particularly only cover Libre and Dexcom. And that's because they cover devices. Well, actually, maybe Eversense too. They only cover devices with what's called a non-adjunctive indication, meaning that they can be used to make treatment decisions. And then a person needs to be taking multiple injections a day of insulin. So typically 3 or more injections per day. And then you need to show that there's a need to adjust the insulin based on those readings, which most people can show that there's a need for that. But the key is 3 or more injections a day. And they do cover it for type 1 or type 2 diabetes. There used to be a requirement that you had to have 4 times daily Fingersticks to get it through Medicare. And I'm happy to say they got rid of that. So that's one less barrier, and it makes it easier for people with Medicare to get these devices. So I'm going to start off by talking about the Dexcom G6, and this is a 10-day wear. You can see the picture here of what it looks like, and there is a 2-hour warm-up period. And what we mean by that is when you put on the device, you do have to wait 2 hours before you'll start to see your blood sugar readings. And this is FDA approved for ages 2 and over. There are no calibrations required. And what I mean by that, a calibration is when you need to do a finger stick to kind of confirm the accuracy of the device. And the G6 does not require that. There is an option to do a calibration, but it is not required. And then it's a 1-press inserter. There is a transmitter that has to be attached. So first you insert the sensor, then you attach the transmitter, and the transmitter is good for 3 months. Each sensor has to be changed out every 10 days. And then you can choose to use a receiver or a smartphone, and it does work with Apple and with Android. And there is a predictive low alert. If you're predicted to reach 55 in the next 20 minutes, that alert can go off. That's an option, as well as customizing the high and low alerts. And then there's multiple apps that go with it. The Dexcom G6 app is the app you would have on your phone to see your readings. Dexcom Clarity allows you to see kind of more information and be able to share your data with the clinic. And then there's also a Dexcom Follow app that allows you to have up to 10 followers. So caregivers, loved ones are able to see it. And then we're going to talk in a little bit about what ICGM status means. So this is just showing what the device looks like. And you can see it's a 1-press inserter. So the inserter is a little bit big, but you literally just press the button and you remove it. And then that gray piece is the transmitter. You go ahead and you attach that piece. And then typically you're going to rub around 3 times just to make sure it's on very well. So the next device that I want and it's seeing if you add people, do they also need a transmitter? So going back to the G6, so no. So if you have followers, they don't need any special equipment. They just need the Follow mobile app on their phone. And then they're able to see the data and get alerts, in real time for highs and lows. So it can be really nice, especially like parents for kids and things like that. Now, the next one I want to talk about is the Medtronic. And the Medtronic actually kind of has two, but they look the same. So the Guardian Connect is a standalone device, meaning you don't need to have a pump or, anything special with it. It works with a smartphone by itself. The Guardian 3 looks identical to it, but it works with their pump, with either the 670G pump or the 770G pump. And it actually can work to automate insulin delivery, which is pretty cool. So both of these are a 7-day wear, and they have up to a 2-hour warm-up period. Now, this one is not FDA approved for dosing decisions. So what it means is if you are going to be, giving yourself insulin based on that number, you would need to, it's recommended to confirm with a finger stick. In addition to that, there are calibrations required per day. Generally, 2 to 4 are required per day. And some additional glucose checks are required when using the pump to help it run efficiently. So for all those reasons, I would say people don't love the finger sticks. So that sometimes that's a slight barrier to use. There is a reusable transmitter. So similar to Dexcom, there's a transmitter that you insert and you hang on to. That transmitter actually is good for a year or more. It does need to be charged in between use. So the Dexcom, you don't need to charge that transmitter, but this one you do need to charge it every 7 days. And there's also several mobile apps that go with this. So there's the Guardian Connect app for the standalone CGM. And there's also this neat app called Sugar IQ, which helps to kind of come up with patterns, like how certain foods might affect you and certain predictions. There's also high and low alerts and predictive alerts that you can use through here. And you can have followers, but the followers have to be through the CareLink website. It's not like a separate mobile app. And there is a mobile app for people that use the 770G insulin pump. There is a mobile app that goes with that pump that people can use to see their readings as well. And this just shows you what this one looks like. So the image on the left is actually an insertion device, and you load the sensor and then you end up pressing both sides. You can't see, but there's 2 green kind of parts on both sides. That's what inserts it. When it's inserted, it's going to look like this image in the middle. And then you go ahead and you attach the transmitter. And then there's some additional taping just to make sure it stays on and everything. I see another question that came through. Do you continue to use Trulicity when using these glucose monitoring systems? And I do. So Trulicity, for those that don't know, is a drug called a GLP-1 agonist. And it works very well for people with type 2 diabetes, and often is, recommended before we consider insulin. And so, yeah, absolutely. I'd be happy for someone using Trulicity to use one of these systems. And even if they're using insulin, they can use insulin and Trulicity and a CGM. That's no problem. So the next one I want to talk about is the Freestyle Libre, and keep the questions coming because I love answering questions. It's fun for interaction. So the Libre, and right now I'm talking about the original 14-day. So this one doesn't have alarms. It is a 14-day wear. And one of the unique things about Libre is that the transmitter and sensor are all in one. The whole thing is disposable, so you don't have to hang on to a transmitter or have that extra step of attaching the transmitter or charging the transmitter. This one only has a 1-hour warm-up, so it's a little bit shorter. And it also is FDA approved to make dosing decisions off of the data, except in those first 12 hours. It's recommended during that time to confirm with Fingersticks. It may be a little less accurate those first 12 hours. This is the intermittently scanned device. So we want to encourage people to try to scan every 8 hours if you can. I usually encourage people to try to scan at certain times, like when you wake up and go to bed and before your meals. maybe before exercise or before driving. And if you do that, you'll probably always meet those 8 hours. If you sleep for more than 8 hours, don't worry. It's fine. If we're missing an hour or two of data, it's not the end of the world. So don't worry about it. If you do wake up in the middle of the night, like lots of people do, and you want to scan it, great, but please don't stress yourself out about that. This has a one press inserter. And then the original Libre does not have real-time alerts. You have to look and actively scan to see what your blood sugar is. And there is a Libre Link mobile app to use your phone as a reader. And there's also a Libre Link Up, which allows you to have up to 20 followers that can see your data every time you scan. Now, most people are now switching over to the Libre II, or they're starting on the Libre II, which has some advantages. So for one, it has alarms now for high and lows. And those alarms occur whether or not you scan. So you can individualize these alarms, and it's very nice because they're optional. So if you don't want alarms, you don't have to, but it's a nice option to have. This one is actually FDA approved for ages 4 and over compared to the original Libre, which is 18 and over. And the accuracy on this has actually been a bit improved as well, especially in the low end of the glucose range. And the mobile app did recently get approved this past summer. It is currently only available for iPhone. So that's just something to know. If you have an Android, you would have to use the reader. Versus if you have an iPhone, you can actually use the mobile app, which there's a Libre 2 mobile app. And then there's also the Libre Link Up you could use as well, where you can have those 20 followers, which is a nice option. So for both Libres, the insertion is the same, but you can't interchange sensors. So for example, you cannot use your original Libre reader with a Libre 2. You have to have the right sensors for the right reader or the mobile app. But essentially, there's 2 parts that you connect together, and then you're going to have it kind of loaded. You see that needle there? The needle doesn't stay inside you. With none of these, the needle doesn't stay inside of you, but it's just what's used to introduce that sensor onto the skin. And then you can see you just press down and it kind of pops back up, and then that sensor is on. And the approved spot for this one is the back of the upper arm. And then Eversense. So Eversense is our only implantable CGM. And so this is interesting. This actually requires an office procedure where a clinician, it's an outpatient procedure, but where they have to do a little procedure to implant the sensor in the upper arm. And this picture up here is what you kind of see. And then there is an outer transmitter that actually goes over that sensor. So what's kind of nice about this is that, that sensor's underneath you. So you don't have to insert it, every 7 or 10 or 14 days. And that transmitter is really easy to remove. So for people that like to be detached and don't want to wear anything, it's a little easier to take it on and off. With the other sensors, you could always remove it at any time, but the cost, they're kind of expensive, right? So you don't want to remove it. If it's a 14-day sensor, you don't want to just remove it at day 5, because then you've wasted kind of the rest of the days. Now, this is also approved for dosing, FDA approved for dosing. However, it does require 2 calibrations a day, every 12 hours. So you still have to do some Fingersticks with this. There is a 24-hour warm-up period, and the dressing actually stays on for 2 days after that procedure. There is actually, they're working on a 6-month version, and the hope would be in the future we'd have a 6-month version, maybe a year version, so then it wouldn't require as many procedures to put that sensor in. And that transmitter does need to be charged every day. So that's just important. And then this works with a mobile app. Again, it's compatible with, Android and with iPhone. And you can also have followers. You can have up to 5 followers that can see your data. And the mobile app, the Eversense mobile app, does have predictive alerts as well. And I see some questions that came through. So this says, you might have answered this, but I missed some of it. Can the reader from the original Libre be used for the new style? So I assume the question is, can you use the reader the original 14-day reader with the Libre II sensors, and unfortunately you can't. So either you need to get the Libre II reader, or if you have an iPhone, you could just use the mobile app. You could download the app from the App Store and use that as your reader, and you wouldn't even need to get a reader. And then I see another question that's come through. I'm assuming these can be worn while showering and swimming, and that is a good assumption. Yes, all of these are waterproof. And so yes, absolutely. We encourage showering and bathing, and even you can go swimming. So yes, all of those things. So I have this chart here that just kind of compares, and there's a few things I want to point out that I didn't mention. So one of those is like the FDA approved sites. Each one has certain sites that, you know, have been FDA approved. And you can see here with Libre, it's actually the upper arm. With Dexcom, it's the abdomen, or actually also the upper buttocks area for kids. And then for Guardian, it's actually the upper arm or the abdomen. And then for Eversense, it's, you know, it's implanted. It's only the upper arm. One caveat with this, though, is that every person is unique, and you can talk to your healthcare provider about if you may need to try alternate sites. Because for some people, their arm is not a good spot, or for some people, their abdomen is not a good spot. Maybe you have scar tissue or you have bruises, and it's just not as good for you. So we can use alternate sites off label, and we often do. You know, we often do, you know, for one, we may use the stomach instead of the arms. Some people use their legs. So you absolutely can. And I'm seeing another question that's come through. Is it possible for the Eversense to get dislodged since it's in the arm? So generally the way the procedure is, they have very good accuracy in terms of it's under the skin. So usually it stays in place pretty well. And then that outer transmitter, it's taped down. So if the outer transmitter came off, you could just put it back on. But yeah, typically that sensor stays in very nicely and it does not get dislodged from people. All right. And then you can see here the kind of the comparison of the maximum wear times. So the second part of this table that I wanted to show you is really the drug interactions. And that's something I haven't mentioned yet. And so each one does have some certain drug interactions that are helpful to know about. So for example, with the Libre II, there's actually an interaction with vitamin C. And so that's important because if you take vitamin C, that can actually falsely elevate those sensor readings. It's not that it's making your blood sugar higher. It's just like it's an interaction with the sensor. This typically occurs at doses of 500 milligrams or greater. So I usually don't recommend vitamin C. The evidence for its use is very, very weak. But if you are going to take vitamin C, I usually encourage people not to take any more than 500 milligrams so that you really have a very minimal interaction with that. The salicylic acid with the Libre 14-day, that's actually what's in aspirin, but don't fret. Don't stop taking your aspirin. Only doses that are higher, like 650 milligrams or more, are going to interact. So anyone taking a low dose aspirin, you don't have to worry about that. And then hydroxyurea actually interacts with the G6, actually, as well as the Guardian Connect. But that's a drug not so commonly used. It's used to treat some cancers and, and sickle cell. So it's not a very commonly used drug. But if you were taking it, that could have a drug interaction. And then the acetaminophen is a more common one that can falsely elevate Guardian readings. So that's important to know. And then tetracycline antibiotics can falsely elevate Eversense readings. So I see another question. Are these types of monitors used for insulin dependent with meals only? So no, actually CGM can be used with I would say for anyone with diabetes, you could use CGM. I think the challenge becomes getting insurance coverage. Some insurance plans will only cover for people that are taking insulin. However, we are seeing prices come down, especially with the Libre. The Libre with commercial insurance, it typically does not cost more than $75 a month. Now that's still, you could say that's still a lot of money. It is a lot of money. But compared to some of the costs of other devices, that is less. And so some people do choose to pay out of pocket to pay that price for it. And some insurance plans will cover for people without insulin. So it just really kind of varies a lot. We are seeing more evidence on the benefits for people just on a once a day insulin or even not on insulin. And hopefully more insurance plans will start to cover it, because also it saves money for, for test strips and stuff too. So I see a question, Tylenol used to affect the Dexcom. Is that no longer the case since it just mentions the hydroxyurea? So that's a really good question. Yeah, they did reduce that Tylenol interaction. So just going back to this, now Tylenol typically doesn't interfere. It's only in doses of 4 grams per day or more. So the reason it's not listed is because 4 grams is exceeding the max dose. And so as long as you're staying within kind of the usual dose, it's not expected to have an interaction, but it used to. So that is a really good question. And then I'm seeing a question, GMI and Dexcom doesn't match A1C averages. For example, 135 average glucose is 6.5, but 135 is 6.3, 121. Okay. So for those that aren't familiar, GMI stands for glucose management indicator, and that is an estimate of an A1C. And so your CGM report will tell you what your estimated A1C is. And it's great because you can compare that to your actual A1C. However, they're rarely going to be identical. It is an estimate. Actual A1C is dependent on your red blood cell turnover. And there's a lot of things that can impact that. And so they're probably not going to be identical. They should be fairly close. Usually they're within 0.5% of each other. But they should be, they are not going to be identical. And that's important to know. And there's a lot of things that can actually falsely skew the A1C. So in a lot of ways, having the GMI and the CGM data is really, really helpful to have that. And then I just wanted to introduce this concept about ICGM. So 2 of the devices, the Libre II and the Dexcom G6, are both considered ICGM. And that means it can be integrated with other connected devices. And this is really the future of diabetes management. And to meet this status, it means the accuracy has to be exceptional. So both of those have met this. And if you're wondering, well, what kind of devices can be connected? This is just illustrating some of the ones we have. And so we've got, the T-Slim, Control IQ, and Basal IQ. Which can automate insulin delivery or suspend insulin based on CGM values. We have Medtronic 670 and 770G, which also can automate insulin delivery. And then we have 2 connected pen devices that can show data with the CGM and actually have bolus calculators to help someone know how much insulin to take. So lots of really excitement in that area. And I'm seeing, I do take the long-acting insulin in the morning, but I take every oral med also. Okay. So yeah, so I think, someone who's taking a long-acting insulin and oral meds can be a great candidate for CGM. There was recently a clinical study that tested it in that population and showed great benefits. So absolutely, that could be a good candidate. Now, one of the common questions I do get is about sites and how do you keep your, how do you keep it on and everything? And this is just showing that there's a lot of different products. So if that is something that you are finding as a challenge, talk to your healthcare team, talk to your diabetes care and education specialist, because there's a ton of products out there and usually we can find the right combination. I wanted to just introduce, I mentioned lag time before, but if sugars are going up or down quickly, you may notice that the numbers are a little bit higher or lower than a finger stick if you checked a finger stick, and that is totally normal and everything. And there are certain times when you still want to do a finger stick, even with a device that can replace finger sticks. Technology is not perfect. And if there's ever time where your symptoms don't match what the number is saying, that would be a time to check a finger stick. So I always say, if in doubt, just check it out. It's better safe than sorry, such as if you're feeling low, but it's saying you're not, or vice versa. Good time to check. And then lastly, if you're wondering if you want to learn more, I want people to feel empowered and know about their technology choices. There's a great website called diabeteswise.org. And I encourage you to go there. It'll ask you questions that are relevant to you, and you can learn a lot about your different options and everything. So with that, I'm going to turn it back to Sue to see if there's any kind of final questions that she has for me. You might be on mute.
Now I'm back.
Oh, there we go.
Thank you so much. That was jam-packed, and we're right at the 4:15. So thank you so much, and thank you for all the great questions. That's a great website for people to go to. But I got to introduce the next speaker.
All right. Well, thanks so much for having me. Thanks, everybody.
Take care.
Bye.